Bites and stings of aquatic organisms. Injuries caused by jellyfish, Portuguese man-of-war, sea anemones, and corals. Stings caused by jellyfish, Portuguese man-of-war, sea anemones, and corals are the most common envenomations experienced by humans in marine environments. All of these creatures are members of the phylum Cnidaria, formerly known as Coelenterata. They are divided into three major classes. The first class, Hydrozoa, includes the Portuguese man-of-war, fire corals, and hydroids. Jellyfish belong to the second class, Scyphozoa. The third class, Anthozoa, encompasses sea anemones and true corals. Approximately 100 of the 9,000 species of Cnidaria that have been identified may cause injury to humans. Prevention of jellyfish stings. 1. Swim only at patrolled beaches with properly trained lifeguards and adequate treatment facilities. 2. Avoid swimming in infested waters, especially after a storm, because stings may result from remnants of floating damaged tentacles. 3. Beware of apparently dead or beached jellyfish. 4. When snorkeling or scuba diving, wear protective clothing such as a wetsuit, long-sleeved shirt, pants, or long woolen underwear, and gloves. In areas where Irukandji syndrome occurs, wear a lycra stinger suit. 5. Use sunblock containing jellyfish and sea lice repellent. 6. Bathing beaches should be closed during periods of high jellyfish infestation. First aid treatment of jellyfish stings. 1. Remove or rescue the victim from the water. 2. Stabilize vital functions, airway, breathing, circulation. 3. Immobilize the affected part to prevent further envenomation by adherent tentacles. 4. Identify the type of jellyfish sting by considering locale, time of year, and indigenous species and by observing the sting pattern. Preserve a portion of the tentacle for future identification. Tape strip or scrape the sting site for microscopic analysis of the nematocysts if no tentacles are available. 5. To prevent further envenomation of the victim and to reduce the chance of a sting to the rescuer, disarm the nematocysts before removing the adherent tentacles. Organism-specific and follow-up treatment of jellyfish stings. 1. If Chironex fleckeri or other box jellyfish species that cause the Irukandji syndrome are suspected, douse or spray dilute acetic acid, 3% to 10%, or household vinegar over all areas of tentacle contact for at least 30 seconds. 2. For sea nettles, mix sodium bicarbonate, baking soda, with water to form a slurry and pour over the affected area or apply the powder directly to the tentacles. 3. For physical stings, a slurry of baking soda is indicated. Vinegar had been reported to neutralize nematocysts of P. physicalis, but work with species from Australia indicate that it may cause a discharge of nematocysts in some cases. 4. If vinegar or baking soda is unavailable, papain, available as a powdered meat tenderizer, may be applied directly as a powder or mixed in water as a slurry to sting areas and tentacles of both sea nettles and Portuguese man-of-war. 5. If nothing else is available, the tentacles can be rinsed off with seawater. 6. Do not use fresh water, methylated spirits, or alcohol in any form to deactivate tentacles, because these all may cause a rapid massive discharge of nematocysts. 7. After the tentacles have been disarmed, they may be carefully removed with a forceps or gently scraped away from the skin with shaving cream and a razor or a plastic card, shell, or knife.